Hello everyone, my name is Tony Medina and today you're going to learn about cheekbone reduction surgery. Stay tuned to the end of the video for some pro tips. The cheekbones are two bones on either side of your face that are irregularly shaped and define your cheeks. People who are looking for zygoma reduction often feel that their face is too big or their cheekbones protrude out too far, and so they look for this kind of surgery. They want to have better balance in their face overall and opt for this procedure. You are beautiful the way you are, but if you want to learn more, keep watching. There are two main methods to reduce the projection of the cheekbones. The first is with shaving. It requires an intraoral incision on either side of the face, and the cheekbone is shaped just ever so slightly. The result is a slight narrowing of the cheekbones, but if you would like a larger change in your cheekbone, then you need the second method. The second method also requires an intraoral incision to be made on either side of the mouth near the nose bridge on the inside. However, there's a second incision point that's made on the outside of the face, right here near the sideburn area on either side of your face. Two pieces are cut, the zygoma is rotated, pushed in, and thus you get a larger change in your zygoma. The scars on the inside, of course, you can't see, and the scars on the outside do fade over time and become virtually invisible. With the second method, two incisions are made. The first incision is on the inside of the mouth, an intraoral incision, near the nose bridge area. With this method, on either side of the face, you need to remove pieces of bone. When the piece of bone is removed, the zygoma is turned, arched, and pushed inwards. The last step would be to reattach the zygoma to the rest of your face, and that's usually done using screws, attachments, sometimes plates, but often just screws and attachments. What kind of cuts are made? The first kind of cut that is made is an L-shaped cut, also known as L osteotomy. The cut is made in an L shape using a precise saw cutting tool, and there are two kinds of options you can choose from. The first is called a low L osteotomy, and the second is called a high L osteotomy. Low L osteotomies cut a little bit lower on the zygoma, which means that you get a smaller reduction. A more preferred method in Korea is the high L osteotomy method. The high L osteotomy method calculates the MMP, the most protruded part of the bone, and makes the incision a little bit higher up on the zygoma. This allows for more volume to be removed, and thus you get a better result. So remember, a low L osteotomy gives you a slighter reduction, and a high L osteotomy gives you a larger reduction. Once the L-shaped portion of the bone is removed, the area is smoothed out as well. The second cut is made in the back of the zygoma near the sideburn area on the outside of the face. This can be done in a perpendicular or vertical manner, or a diagonal manner. Perpendicular or vertical cuts don't allow for maximum movement and reduction of the zygoma bone. So if you would like a larger change, then you should consider a diagonal cut. Once this cut is made, that piece of bone is removed, the area is smoothed out as well. The next step is to push the zygoma inwards and rotate it to its optimal position. Once that's done, the surgeon needs to reattach the zygoma to the rest of the body using screws and attachments. The incisions made on the inside of your mouth are then sutured. Often they'll have dissolving stitches, but sometimes not, depending on your doctor's choice and your needs. On the outside, they're usually not dissolving stitches, and you need to come back to the clinic anywhere from 7 to 14 days later to get those stitches removed. Normally, stitches on the outside of the face are removed around the 7-day mark. A question I often get asked is, are these things in my face going to beep and go off at the airport or when I'm passing through security? No, they're not going to do that. These materials are titanium or mixtures of titanium and other materials that do not go off in metal detectors or at the airport. Another question I get asked is, can I get these removed after I have surgery? The answer is yes and no. You can get these removed after surgery, but you're going to be left with scars and it's a lot of pain and recovery, and it's not necessary. They can be left in permanently and will not negatively impact your health. You won't even notice they're there unless you take an x-ray. If you take an x-ray, you will be able to see them, but besides that, they don't really do any negative damage to you. What about dissolving screws? So the field of dissolving screws is really promising, but it's not quite there yet. Dissolving screws are made of a magnesium blend mixture, but they do have a few problems right now, and there's not enough research done for them to be widely accepted for use in Korea for zygoma reduction cases. There are a few doctors that do use magnesium blend dissolving screws, but it's on a case-by-case method and it's not completely tried and tested yet. One, they could dissolve too soon, which could cause instability and fractures, and two, there could be a buildup of gases on the inside, which could also cause you problems. So for now, you can think about it like this. By the time I get surgery, if dissolving screws are not widely accepted, I should just go with the regular titanium screws and just live with it. If by the time I get surgery, dissolving screws have been fully accepted by the medical community, at that point, then I'll go for dissolving screws. Will I have saggy skin afterwards? The answer is yes and no. In fact, to most plastic surgery things, the answer is yes and no. It depends on your case. If you're someone that has a lot of tight skin elasticity, you may not need any kind of lifting procedure afterwards. But with someone with looser skin, or if the change in your cheekbone structure is really vast, you may have slight sagging skin. If it's determined that you have the possibility of having saggy skin, there are several solutions. The first is something as simple as going through an ultrasonic electrical impulse treatment, often known as HIFU, high intensity focused ultrasound. This treatment sends ultrasonic electrical impulses deep into your skin, which pull and tighten the area. If you require something a little bit stronger, you can think of thread lifting. There are several kinds of thread lifting, anywhere from ones that you can get just with topical anesthesia to the ones that require you to go under sleeping anesthesia. The more saggy skin that you possibly may have, the stronger the threads need to be. If your case is more advanced, you can consider something like a mini facelift or even a full facelift. Again, in many cases you won't need anything at all, and Zygoma reduction alone can be done. What kind of anesthesia is used? This procedure is normally done in Korea under general anesthesia. You'll have a separate anesthesiologist monitoring you the entire time, putting you under and waking up. General anesthesia requires a tube to be down your throat in order to help you breathe, and your body can't move during the procedure. This makes the procedure extra safe. If you were to go under a different kind of anesthesia, like local with sedation, you would be asleep, you wouldn't feel any pain, but you still have the possibility of moving during the surgery. So most surgeons prefer general anesthesia. Waking up from general anesthesia is a little bit tougher than waking up from local with sedation, and you're going to be required to fast a little bit longer before you have the procedure. How can I prepare for this procedure? The first thing you should do is, if you smoke, stop smoking. Smoking really distorts your immune system and will really slow down your healing process. If you can stop smoking 1 month before the procedure, that's great. If you can't, well, there's kind of no choice, but just try to stop smoking as fast as you can so you have better results afterwards. Remember that smoking may increase the risk of infection, swelling, and bruising, so quitting smoking, probably a good idea. If you take blood thinning medication, you need to stop that. Things like aspirin, you need to stop that as well. Drinking. If you want to drink a lot of alcohol right before surgery, that is not a good idea. You should stop drinking alcohol for at least 2 days before surgery, if not longer, for the same reasons as smoking. In terms of your diet, the healthier your body is, the faster you're going to recover. We find that people that have eliminated processed foods and processed meats recover a lot faster than those who haven't. In fact, people that are more on a vegetarian or even vegan diet tend to recover faster, have less bruising, less swelling than those who are on a heavy meat diet. It's up to you to eat what you want, but remember that a plant-based diet mixed with some fruits is going to give you better results than something that's very meat heavy or very processed food heavy. Here's a pro tip. You're going to need to fast for 6 to 12 hours before surgery, depending on your doctor's recommendations. So, right before you go to bed, drink a lot of water and eat something that's not salty, otherwise you're going to be thirsty in the morning. And then when you wake up, you'll be ready to go for surgery. If you schedule the surgery for late in the afternoon, you're going to spend the entire day thirsty, wanting water, and pretty hungry. So what's best to do is to schedule your surgery for the morning. Most clinics in Korea open around 9:30 to 10 a.m. So you're going to want to schedule your surgery for one of those times. However, clinics get full, doctor schedules get full. So if you want a last minute surgery, you're just going to be put into the spot that's available. And if it's late in the afternoon, you're going to have a pretty tough day. That's the reason why it's really important to book way in advance if possible. If you book way in advance, you're going to get not only the day that you want, but the time slot that you want to, and I really recommend being the first surgery of that day. That way, you don't have to be hungry and thirsty the entire day. What should I expect after surgery? Immediately after surgery, you're going to feel a bit groggy, and this is from the anesthesia. If you've had general anesthesia, it usually takes a bit longer to recover. Some clinics will want you to stay overnight for observation, and some clinics allow you to go home that same day. It really depends on your case, the difficulty of your case, and what the doctor thinks. You're not going to be in agonizing pain or anything like that, but it is going to be uncomfortable. You should expect bruising and swelling to rise for 2 to 3 days, plateau, and then start to slowly come down. This is why using ice packs is very important immediately after surgery. You're going to get a list of aftercare surgery instructions from us. Follow those instructions and you'll be able to control your bruising and swelling better. When you come back for your in-clinic aftercare treatments, you're also going to undergo laser light therapy and different anti-swelling treatments such as an anti-swelling injection. This will help you to recover faster. Some people require a head garment for compression. This looks a little bit funny. You kind of look like an egg. My friend calls it a head bra, but you're going to see people all around Gangnam walking around with them, so you'll fit right in. Plastic surgery in Korea is very accepted. Everyone knows about it. No one judges you, and you see people just shopping in the street like the day after they've had surgery, so you'll fit right in. Some people don't get this kind of head compression garment. It really depends on your case. A really important thing is that you can't just stay in bed all the time after you've had surgery. If you stay in bed all the time, your swelling actually increases. You need to get up and walk around in order to get your blood flowing. You need circulation. This will help you to heal faster. You shouldn't be exercising for 3 to 4 weeks, in some cases for up to 2 months, but it really depends on your case. You can walk around though. Walking around is much better than just laying in bed. You may see immediate results after surgery, but then swelling comes. After 2 to 3 weeks, the swelling has started to die down and you're going to see those results come back. After a month, you'll be better, and after 3 months, you're pretty much set. However, full healing tends to take place on the outside about 6 months later, and although the majority of internal healing is done by then, it may take up to a year for full recovery. Will my face be perfectly symmetrical after surgery? The answer is no, and don't expect it to be. Please don't expect perfection or you're going to be extremely disappointed. Many people come in expecting their left and right sides of their face to be perfectly even after surgery, and this is not possible. We are limited by our own body's structures. What most surgeons will tell you is that you can expect 70 to 80% of what you think is going to be possible, and that's the realistic number. So you can expect some asymmetry, but it's going to be so much better than it was before. If you keep focusing on the little bit of asymmetry you have left, it's really going to affect you mentally, and it's probably going to make you very unhappy. So it's not a good idea to do that because that's something that just can't be fixed. And if you go ahead and you think about it more, you may put a little bit of filler here, a little bit of filler there, and it's just never going to be exactly how you want it. So my advice is accept the realities of what is possible with plastic surgery. Expect about a 70 to 80% improvement in asymmetry, and think that that's actually the maximum that you can get. And if you see slight imperfections in asymmetry, just understand that it's not possible to go anymore because you were just born that way, and this is the maximum amount of change you can have. In terms of temporary asymmetry, that's a whole different story. Some places take more damage than others during surgery. You may have more scar tissue in one side than the other. That means that the healing is not going to be identical on both sides. This side could be more swollen than this side, or after you have surgery, you might have slept on one side and that side might be swollen and this side might not be swollen. This means that there's temporary asymmetry that's going to go up and down. It'll look like waves, but over a month or so, it'll cool out, and then over the next 3 months or so, it'll pretty much be set. Temporary asymmetry will go away, so that's not something to worry about. As I mentioned earlier in the video, you cannot exercise hardcore immediately after surgery, but you should be walking around in order to get your circulation going. 3 to 4 weeks after surgery, you can exercise if your body says it's okay. If not, wait a couple months. Every body is different. People that are in really, really good shape tend to recover faster. People that are not in great shape tend to recover slower, so you might need more time. Listen to the doctor's advice and follow it. Not everybody is a candidate for this surgery. If you're under 18 and you have unrealistic expectations, you're not a good candidate for this procedure. One more big reason you may not be a candidate for this procedure is that it may not be the bone structure that is causing your cheekbone to look wide. You may have large buccal pad fat. This can be removed intraorally and you may not require Zygoma reduction at all. Other procedures that go well with Zygoma reduction are square jaw reduction, also known as mandible jaw reduction. This can happen in 2 stages. One, just a little piece of the jaw is removed here. This is known as a shortcut. You can also make a long cut where it goes all the way towards the chin, shaping the chin as well. This is also known as part of V-line surgery. Another separate procedure that goes well with this is genioplasty, or any work done to the chin, which is also known as part of V-line surgery. You can shape the chin a little bit, you can take a T osteotomy piece out, you can do sliding genioplasty, you can reposition the chin. In general, this will move your face to the shape that you want it. V-line surgery is very interesting because V-line surgery is not actually a technical term. It's just something people know these procedures as. V-line surgery can encompass the jaw, the chin, and even the zygoma. So zygoma reduction can also be part of V-line surgery. How do I get a one-to-one consultation? Well, you contact Seoul Guide Medical, and you can do so at consult@seoulguidemedical.com. You answer all of the questions that our staff needs, and we will get back to you with a treatment plan. Remember that this is not immediate because we physically have to go through the data, we have to consult with our doctors, and then we have to get back to you, so it can take a little bit of time. If you want to contact me directly, you can do so at Tony Medina on Instagram. This is the best way to reach me. If you like this video and you think it's useful, follow us, subscribe, give us a like, and a comment. All of these things help the algorithm to find us and thus spread this information out to people that need it. I hope this video has been useful, and thank you for watching.